This is the first in our case series of acute subdural hematomas seen on non-contrast CT scans. And this is a tricky one, which is actually, not uncommon for subdural hematomas. Part of the reason we discuss them for the purposes of this call prep curriculum. So to start with this case, we're going to stick to the basics here. What we're going to do first is we're going to window for success, mainly because the standard brain window we're using here is going to make it very easy for us to miss blood products. So what I'm going to do is use one of our presets. This is a 60-160. 60 is the level, 160 is the window, and already with that preset, we see that these blood products here, this is actually where the subdural is, become much more obvious compared to before. And now what we can do is we can kind of adjust this window a little bit. I kind of like to adjust it slightly, maybe more like this, which will help us with some other blood products. But ultimately, the density of your subdural is going to help inform which subdural window is best. This one is closer to like a 90-200 for the level and window. And but regardless, you want to have something like a 60-160 is a very reasonable place to start, and then you can kind of window and adjust manually to kind of make these extraaxial spaces appear as prominent as possible. Now, this is very tricky because its location is near where we see kind of this typical dural thickening, which is what we see on the other side. And but this shape it's too much. It's too enlarged. It's asymmetric to the other side, so this is a very small subdural. Now, we talked about previously how it's useful to have the coronals, and we can kind of adjust and get to our subdural epidural window as well too. But really in this case, the coronals are not going to be the most helpful. Technically, you can see that there is the subdural blood right here, kind of along that area, but it's very subtle, and it's going to be very hard to definitively say that there's more on one side versus the other. This is just not in the right plane for making this finding, and the axial really is going to make it a lot easier. So this is a good example of where the finding is really best seen on the axial, and that's pretty much it. But the point is that you still want to do proper windowing, which is going to make it a lot more obvious to find these subtle blood products.